Welcome Triun employees. It is that time of year where you will be enrolling in your employee benefits. Open enrollment starts on Sunday, March 10 through Friday, March 15, 2024. There will be a change in the medical carrier, therefore, it is required that you enroll again. Your benefits will not roll over. Barrett Insurance Services is proud to serve you, and we will be with you throughout the enrollment process and continue serving you throughout the year. Insurance can be complicated, and there are several terms that are important to know to help you better understand your coverage. Network is a group of healthcare providers, including doctors, hospitals, and other healthcare providers, which have agreed to provide care at a lower cost. It is important to select a doctor, hospital, or clinic in the network to save money. Medical providers who are not in the network will be substantially more expensive. A co-pay is a set dollar amount you pay for network services, for example, a doctor's office visits, emergency room care, and prescription drugs. For example, the copay to go to urgent care is $25 and the copay for a Tier 1 medication is $5. A deductible is the dollar amount you must pay for covered medical expenses each year before the plan pays for certain services. The deductible does not apply to in-network preventative care and any services where you pay a copay. For example, you break your leg and go to the emergency room, you will have to pay for all services until you have met your deductible. Co-insurance is the percentage of your medical costs you must pay for certain services after you meet your annual deductible. For example, if you break your leg, you will have to pay the deductible, and if there is still a balance, you would have to pay 20% of that balance. Out-of-pocket maximum is the maximum amount you must pay toward covered medical expenses in a calendar year. Once you pay this amount, the plan pays the entire cost of covered services for the rest of the year. Deductibles and co-pays apply to the out-of-pocket maximum. Triun will contribute $315 towards the cost of the employee's medical premium. The chart indicates the employee portion after the company's contribution. Triun is offering two plans, a base plan and a buy-up plan. The following slide will provide more details on the plan's benefits and the comparison. This year medical coverage will be provided by United Healthcare. United Healthcare has a large network throughout Texas. The most important thing to remember is always verify that your doctor, hospital, clinic, or lab is in the network. This will keep your cost down. When deciding between the base plan and the buy-up plan, the main difference is the deductible. The deductible is $3,000 on the base plan and $2,000 on the buy-up plan. If you know you are having an upcoming medical event or planning a baby, the buy-up plan may be your best option. The other notable difference is the out-of-pocket maximum. As you may recall from the definitions, the out-of-pocket maximum is the maximum amount you would be responsible for in the case of a costly medical bill. The out-of-pocket maximum under the base plan is $6,000 and under the buy-up plan it is $5,000. These are the only differences between the two plans. Under both plans, your routine physicals, preventative care and virtual visits are provided at no charge. The virtual visit is a great resource when you are feeling sick or have a medical concern and do not have time to go to the doctor's office. A simple phone call with a licensed medical professional will diagnose you and provide a prescription if needed. A visit to your primary care physician has a $10 copay and children under 19 do not have a copay. To see a specialist doctor, such as an orthopedic, OB/GYN, urologist, etc. The copay is $40 if you use the designated network or $80 if you use the general network. The best thing to do is to verify with customer service that your doctor is in the network. A trip to an in-network urgent care facility has a $25 copay. Diagnostic test, including X-rays and blood work, have a $40 copay. Imaging, including CT, PET scans, MRI, have a $500 copay. If a trip to the emergency room is necessary, you will be responsible for the entire cost until your deductible is met. And remember, it is $3,000 under the base plan and $2,000 under the buy-up. When the deductible is met, you will then be responsible for 20% of the bill. A visit to the emergency room can be costly, and there may be other options. It is important to know where to go. For non-emergencies like the flu, a rash, or sore throat, you may want to call the virtual doctor, which is at no cost to you. Back or neck pain, cuts that require stitches, a sprain or fracture could be taken care of at the urgent care. Do not take chances with chest pain, severe abdominal pain, trouble breathing or uncontrolled bleeding. It would most likely be better to go straight to the emergency room. Both inpatient and outpatient hospital services require you to meet your deductible, then you will be responsible for 20% of the remaining balance. Prescription costs are based on a tier system. Tier 1 medications have a $5 copay, Tier 2 have a $30 copay, Tier 3 have a $65 copay and Tier 4 have a $150 copay. The costs that have been stated refer to in-network providers. When you go out of network, the cost is significantly higher. The best option is to call ahead to United Healthcare and verify that your doctor, hospital, clinic, and lab is in network, so you will not be surprised by an expensive bill. Triun will pay 100% of the employee's dental premium. Dental coverage is offered by Principal. Principal has been the dental provider for the past few years. The coverage remains the same, and there was only a slight increase in premium cost. The chart indicates the cost to add your family. It is important to note that you receive 2 cleanings per year at no cost. Research has found that there is a direct correlation between oral hygiene and heart disease. Take advantage of these free cleanings. If you need basic care, to include cavities and fillings, the deductible is $50, and you will pay 20% of the remaining cost. For major work, oral surgery, root canal, crowns, for example, the deductible is $50, and you will pay 50% of the remaining cost. There is a $1,000 maximum yearly coverage. This means that if work is needed that exceeds $1,000, the employee is responsible for the entire amount over $1,000. Triun will pay 100% of the employee's vision premium. Vision coverage is also offered by Principal. Principal has been the vision provider for the past few years. The coverage remains the same, with no increase in premium cost. Principal uses the VSP Choice 130 network. This is a large network that is accepted almost everywhere. The eye exam has a $10 copay. This plan allows you to replace your frames every other year. The cost of lenses has a $25 copay, and the maximum allowance for frames is $130. If your lens prescription has changed, and you received new frames last year, the lenses will be swapped out. If you wear contact lenses, you can order them every year. The fitting cost is $60 and you have a $130 allowance for contacts. Principal offers a discount for LASIK surgery. Triun offers a $25,000 term life insurance for all full-time employees. This policy has an accidental death and dismemberment provision. If the employee dies in an accident, the coverage will double. For the most part, open enrollment is the only time you can make changes to your benefits. It is very important to consider who you want to insure and what plans you want to elect. Life happens, and insurance regulations allows changes during the year if the employee or his family members experience a life-changing event. A life-changing event could occur for many different reasons. For example, a marriage or divorce, a new baby, a spouse or child losing or gaining coverage elsewhere. If this occurs during the year, you will need proof of the change within 31 days. If you have questions about a qualifying event, please reach out to Barrett Insurance for clarification. Thank you for viewing this presentation. Barrett Insurance is here to help you. Please reach out to us anytime. Disclaimer: if any discrepancy exists between this information session and the official plan documents or policies, the official plan documents will govern.